My name is Tseng. I'm a pediatrician, a pediatric neurologist, and I am currently the CEO of the POLG Foundation, which is a rare, ultra-rare mitochondrial disease research advocacy group. And our focus is raising awareness, raising funds to deploy it into areas of research that will get us to the clinic. Share your journey and key experiences that led you to this role or area of expertise. I've always wanted to make medicines. I started out going to medical school to do an MD PhD, of which I did a PhD in molecular biology and genetics. And as a pediatrician, pediatric neurologist, it was clear that there were no treatments, no medicines, no cures. It was diagnose and adios, which was not a very satisfying career. So I was highly encouraged or highly discouraged to go into pediatric neurology because there were no medicines other than anticonvulsants. And so to me, it just was the area of most unmet medical need. And I've gone into this area full bore and have been blessed to be in various opportunities and teams to make medicines for children. I've worked through MGH Harvard as an academic research lab, and then I've done a big foray into industry, working with Novartis, Advocacy, and Vertex, which focuses on rare disease and pediatrics. And in those areas, I've been blessed to be on amazing teams with incredible science to develop many drugs that have gotten to the market, and some of which fortunately have gotten to India. So my role is really, I'm just a pediatrician who wants to do better for children. And rare diseases is just a brutal place to be. And we have to do better, but it can't be done alone. It's been massive change. There's been incredible legislative policies, incentives, and legislative requirements that have enabled rare disease research to be paved. It's my understanding in recent years, over 50% of the FDA's approvals have actually now been in rare disease because science has lent itself to target genes, and sequencing, diagnostic capabilities have all been enhanced. So I think the rare disease landscape has improved dramatically, but that doesn't mean all 11,000 have been able to been targeted. So I think there's so much more room for opportunity. And how do we leverage the lessons learned to make it more efficient for future rare disease treatments to come online? And I believe by collaboration and sharing knowledge, sharing resources in pre-competitive space, there will continue to be massive improvements in rare disease space. How we will cross the bridge and get it to other countries, including India, thus the genius of this summit and why we need to be talking about it now. And I'm very excited to be here. Oh, there's so many of these. Number one, the challenges are just making a diagnosis. And there are many individuals out there who don't know they have a rare disease. And if they do have a medical problem, it doesn't mean that the DNA test that's specific for them is actually being ordered. So I think there's a huge tip of an iceberg that rare diseases are out there, they're undiagnosed, and that creates twofold problem. One, specific generations of knowledge to provide best medical care is lacking. One patient, one doctor, that experience is parked in an electronic medical record or medical record, but it's not shared across a broader brain trust to provide lessons learned of how to provide better care, what things worked, what things didn't work. So that's one for rare disease. Two, for drug development, for making new medicines specific for the disease, it requires fundamental science, and really encouraging science requires money. And funding into rare disease is doable, but how to make it commercially attractive for biopharma. Many rare disease scientists want to do rare disease research, but they can't get funding. Thus, the research doesn't happen. And that's where patient advocacy groups, NGOs can collaborate and can help fuel this type of research. So far, it's been nothing short of spectacular. There has been so much I've learned, so many connections I've made, so many people in various sectors. And I think the idea of just sharing knowledge, sharing experiences is critical going forward. And the idea that bridging Indo-US makes a lot of sense. So much that it's a crazy idea, but crazy ideas are what changes the world. And I want to credit and thank the organizers, Harsha, and all the thought partners that believe that this is an initiative worth carrying forward. We must do this, and let's do this together. And hopefully I'll see you next year. Thank you. I think from my background of physician scientist, drug developer, academia, biopharma, and nonprofit world, I think I've got some experiences that I'd like to share and hopefully prevent people from making mistakes and trying to just leverage efficiencies, whether it's funds, dollars, ideas, resources. I would love to help offer whatever resources I have to be brought to bear to serve in this vein. And I am eager to be on the team. So thank you for inviting me.